Welcome. I'm Dr. Lori Marbus, and today I'd like to welcome Dr. Andrew McGoey-Smith. How are you, sir?
I'm fine.
Wonderful. And today you're going to share with us about your journal submission of reversal of pulmonary hypertension, diabetes, and retinopathy after adoption of a whole food plant-based diet. And I know this has a special place in your heart, but can you give us a little information on the background and inspiration for actually submitting this case study to the journal?
Yes. So my wife is the case study in question, and she was diagnosed with idiopathic pulmonary arterial hypertension, or IPAH. And that was in December of 2007. And she was given 2 to 5 years to live. Now, the person who diagnosed originally was not a pulmonologist or a respirologist. She was a sleep specialist. However, the actual survival rates haven't changed that much since that time. Certainly the 2 years without treatment probably still stands. So that was the context. And what happened was that after 6 years of different pharmacological interventions, my wife discovered a whole food plant-based diet, and she switched from a flexitarian diet where she ate a little bit of chicken once in a while, but a diet that was largely it would be similar to standard American diet. So when she switched to this diet, her health outcomes really for PH or IPAH and these other diseases, they changed tremendously. And so we didn't plan to do a case study here, but we realized that, hey, we've got 12 years of data, 6 years of data on this flexitarian diet, and 6 years of data after her changing diets. And so we really got a good before and after picture. And that was the history.
Okay.
And the inspiration was the learning about Dr. Esselstyn, and I can certainly tell you about how that came about and what transpired.
Wonderful. So can you tell us a little bit about her clinical state before, the blindness and all of those things that come with that, and then what happened?
Yeah.
Yes.
So December 2007, it took actually 9 months to diagnose the IPAH. Now, it can take more than that. 9 months is actually quite quick because many of the symptoms are common to other conditions. So she had massive swelling in her ankles and legs, edema, and she had loss of energy. She went to the what's called an acute care facility in Canada. So they tested her blood, first of all. It turned out she had an A1C, I think, of about 15%. So she got, serious type 2 diabetes. And then she she went to see a radiologist, and she got a heart scan, ultrasound scan. And the radiologist came back, and he looked pretty nervous and scared, and said, there's something really wrong. You got right heart failure. And so eventually her GP recommended to a risk specialist, a heart risk specialist. And then he thought, well, let's try CPAP, which is a device that you wear at night time to increase airflow. We thought, well, maybe what's happened, she's not getting enough oxygen, she's got a blockage there, and that's causing her heart to swell. So we checked that out for a while, and then she went to see a sleep specialist. And after 4 months, the sleep specialist said, well, look, the heart will remodel, and it didn't remodel, and so she figured it was something more serious. So she just then, after this 9-month period, she blurted out, well, I'm going to provisionally diagnose you with this condition called pulmonary hypertension, and I'm going to refer you to the pulmonary hypertension clinic. And we were fortunate in Calgary, which is a city of about 1.3 million people. It's actually a center for pulmonary hypertension in Canada and worldwide. So she was able to undergo what's called a right heart catheterization, and they were to measure the pressures inside her heart. and it turned out that the pressures, what's called the mean pulmonary arterial pressure, MPAP, it was turned out to be about 40. I think it was, I'm trying to think now, but it was over 40. And if you've got to have less than 25 in order to have a kind of normal heart, typically 20 to 25. But she had this high pulmonary pressure, which was indicative of this pulmonary hypertension. Mm. So that was the diagnosis.
And then she had diabetes, she had the pulmonary hypertension, because she was active before, right? She was
very active, and I used to call her this Energizer Bunny, from the commercials on TV. But she actually in 2001 she started a counselling program for a school board, and it's a school board where we live. It was a rural school board. It actually encompasses an area the kind of size of Belgium or something like that. Just
wow.
In Canada. So she ended up managing the program and supervising, I think it was 12, I'm trying to think if it was 11 or 12 counselors. So it was a demanding job, and she started it from scratch. They didn't have any counseling at all in the school. So they started a counseling, she started this program, and she worked long hours. Now, we thought that maybe she was just fatigued because she was working long hours. She had fatigue for about a year before she was diagnosed, in addition to eventually the swelling. So she thought she was just tired with overwork, but it was more than that. And it turns out that this IPAH, or PH in general, generally affects women, usually around the age of 35. That would be the most common kind of age. And so she was a bit older than that, but she did fit the general demographic for PH. Yes.
So can you tell us a little bit about her eyesight? And she also had some kidney issues, correct?
Well, she did have she had some. Before the time of diagnosis, actually, her eyesight, she struggled with, she had to wear reading glasses, basically. And then what happened, she found Neil Barnard's book, Reversing Diabetes, through the diet she eventually adopted. So she started to eat more plant-based. And in fact, her eyesight improved shortly after diagnosis. She was able to read out of the phone book without her reading glasses. This is just following Dr. Neil Barnard's program for a couple of months. Then when she was diagnosed with the pulmonary hypertension, she was prescribed sildenafil, which people normally call Viagra. It was called Revatio, but it's called Revatio for PH patients, but it's the same chemical compound as Viagra. And within 2 months, sight started to rapidly go downhill. And so she saw a physician, retinologist, and this lady said, "Look, you're going to be blind. It's not going to be, maybe as long as 2 months, but you will be legally blind." And that's what happened. So she went to see a retinologist, and he performed laser surgery and so on. But he said, "Well, I don't know whether," he said, "you're not getting enough oxygen to your eyes. It could be the pulmonary hypertension. Obviously, you've got some diabetic retinopathy because she had untreated diabetes for a long time. And it could also be a side effect of the drug as well." But he said, "I'm not sure." Now, he didn't mention the drug in his official letter to the respirologist, but that's what he said to us. So anyway, yes. So within 2 months of taking, which is quite an effective drug for pulmonary hypertension, it does relieve the symptoms quite well, and it did relieve the symptoms for Kate. She was getting better, but obviously she became legally blind. So the respirologist, while he didn't say it was the drug, he put on another drug called Bosentan, and she didn't have that. Didn't make her eyes any worse anyway. So that's the eye story.
So she had been diagnosed, and then how long before she really focused on a whole food plant-based diet, or what?
What happened was she turned on the television one evening, and there was a talk show on the Canadian Broadcasting Corporation at the time. A guy called George strombolopolis. Now, he said he'd seen this movie, Forks Over Knives. He said, you'd find me at a pig farm eating all the bacon in sight, and he said, I saw this movie and it changed my life. It might change yours. So Kate was kind of intrigued. So we went to see the movie. It was an independent movie. It took a long time to get to the theaters. So that was in 2011. So this was 4 years post-diagnosis almost. And we saw Dr. Esselstyn on the movie. And he did talk about endothelial cells. And then about the following year, we went to a sort of health summit or put on by the doctors at the Pulmonary Hypertension Clinic. And in fact, Kate's doctor gave a really excellent presentation on the basics of pulmonary hypertension. And he said, look, it's a disease of the endothelial cells or endothelia. So, and I remember reading Essie's book, Dr. Esselstyn's book, in the bookstore as well around the same time. And then it reminded me what he said. And Kate and I talked about it and thought, well, maybe obviously there's a connection here. Endothelial cells are big in, have a huge role in pulmonary hypertension, but they also do in heart disease. And Dr. Esselstyn has this great program, and he's sent these fantastic results of his patients reversing heart disease. So maybe he could help. So she emailed Dr. Esselstyn and she thought, well, never hear, I may never hear from him. Well, 2 days later, she gets this phone call from his secretary and says, Dr. Esselstyn wants to talk to you. So he did actually talk to you. He said, look, this is what you get to do, Kate. He said that you've got to follow the diet that I recommend to my patients, which is a whole food plant-based diet. And he said, also, you've got to have these greens. He said, this is very important. You've got to have the greens, green leafy vegetables 6 times a day. So he said, you do that, and, I think it's going to help you. So we thought, well, give it a try. So she did that, and then we also went down to John McDougall's program too, because that's a residential program, and the things you learn how to cook. And then you meet you meet Dr. McDougall, and you meet other practitioners like Jeff Novick, who's a dietitian and so on, and they explain a lot of principles. So he put on a 5-day program. So we attended a 5-day program, got the cooking lessons. She talked to McDougall. He made some recommendations about diabetes, what to do. And then after that, 15 months later, her sight came back. And her sight came back so that she's legally allowed to drive. So her sight came back to 20/46 instead of being 20/200. So there's a huge difference in sight. So going from legally blind to being able to drive. And pulmonary hypertension got a lot better. She went down from functional class 1 to functional class 3. Now, there are only 4 classes. The 4th class, you're definitely lung transplant. And you may not live very long. So
she went from 3 to a 1.
She went from 3 to a 1, and that's in terms of, and that's measured in terms of a 6-minute walk test, how long you can walk, which measures quality of life, how long you can walk in 6 minutes. So she was able to do that, and then also diabetes also cleared up, reversed completely, and she was removed from all drugs, including insulin and metformin and so on.
So her kidney function improved as well?
Well, the trouble is the kidney function is that's a whole different story, and that will be another paper. Unfortunately, one of the drugs was called treprostinil, and she took that drug, and she took a subcutaneous version of that. So we had to use a little pump, which pumped it into the body and went through the skin. And it turned out that when she was on that drug, she gained 80 pounds of fluid, I think it was, in about 2 months. So, and I read through, finally, being a scientist, after this all happened, I read through the manual, that came with the drug, and it's there. Just one sentence said, "Oh, this may cause fluid retention." Well, the fluid retention almost killed her. So she was taken off that drug, and it actually did damage her kidneys. So I don't know whether the fluid retention was because of kidney damage. So it halved her kidney function, which was it was pretty normal before that, but I think it went to around 24. I think it's liters per minute. I believe it is. I think those are the units. So it kind of halved. But then, unfortunately, we had a flood here in Calgary, and she had to have a minor operation, and she was prescribed two antibiotics, IV antibiotics. And these caused, she had an allergic reaction to those, and the kidney function went down to 5%. Had to go to rush to the hospital, and she ended up, most of the nephrologists said, let's do dialysis, all the residents and people. And her doctor said, no, let's see if we can sterilize it with just using IV furosemide, and they did that, and also a steroid, a cortisone, and they were able to get the function back up to about 14%. Now she's remained, she's avoided dialysis now for 6 years, again following this whole food, plant-based diet. Now this will be the subject of another paper. I researched it out, and I heard of one case where someone avoided dialysis. I think they were around 7% or 7 liters per minute kidney function, I believe, for about 9 years as of publication of that paper. Well, Kate's at 6 now. So, that will be a whole other story. So I can certainly, obviously, and in fact, her respirologist originally was skeptical of the diet, but now he's saying no. He said to the dietitians, don't pressure Kate to change this diet, and we'll just tweak it here and there. So if she eats too many potatoes, yeah, she gets too much potassium. You have to cut back on them. So he plays around like that. But that would be a whole other paper, actually.
Wow, fascinating.
Yeah.
So she also lost a significant amount of weight.
Yes. So she lost around 110 pounds. So this is before she got diagnosed to after. So this is, during most of the weight loss occurred 15 months after switching diets. So she certainly, that happened. Of course, at one point she had a massive fluid retention because of that drug. Sure. So that really bumped her weight up. But she's been able to keep off the sustained weight, as with all these other reversals as well, and wow. keep everything stable now for, almost 6 years.
Goodness. So she had this acute onset, she had undiagnosed diabetes, the pulmonary hypertension, drug effects from at least 4 drugs, it sounds like, the IV antibiotics.
4 different drugs. There were 3 different, for treating pulmonary hypertension, the drugs work by increasing nitric oxide inside the body. And when what the nitric oxide does is it makes the blood vessels wide, or what's called vasodilation, right? So they all work the same way. So because they tried all 3 of these types of drugs, so 3 different biological pathways to increase the nitric oxide, and then they actually tried 4 different drugs, and then 2 of they tried 2 combinations of where they piggyback one on top of another. So the standard way to treat PH is start with the Viagra or sildenafil, because that's the cheapest drug. It only costs $1,000 US a month. So in most provinces in Canada and probably the US states, we were the same. What they do is you've got to start with that. That's the protocol. And then if that doesn't work, they'll switch to a more expensive drug using a different pathway. Usually it's what's called Bosentan. That's usually the next drug, and that costs around $3,000 a month. And then for really severe cases, they put people on what's called a prostacyclin. So Kate had a remodeling, which was cutaneous, but the first drug they developed in 1990 is called Flolan, and that actually goes right into the chest cavity, and again through a pump, and that costs $10,000 per month.
Oh my goodness!
As did the remodeling that Kate had. So those are the treatments, and unfortunately, they all come with pretty serious side effects, because especially the Flolan and remodeling, these are like chemotherapy drugs. They're extremely strong, extremely expensive, and they have a very, very short half-life. In other words, they had to be continuously pumped. Right. So if you remove someone really quickly, it can be dangerous. Or if the pump were to fail and pump too much in, they would kill the person. So it's pretty radical, treatment. And many people have been on those kind of drugs, for some as long as 20 years.
My goodness.
Yeah.
So Kate, is she on any medications at this point?
Yes, but she's not on any of these frontline pulmonary hypertension drugs. She takes furosemide or Lasix, which
Okay,
is to remove fluid from her body.
sure.
She does take that. She still has some fluid retention, so she's at class 1 pH. So she's not class 0. The disease didn't completely reverse. Like some
Mm,
heart disease seems to almost completely reverse in some cases, or maybe many cases, but that's not true here. But she's at the most benign classification, so she still needs that Lasix. She
okay,
does take her CPAP machine at nighttime, and she takes oxygen at nighttime. Although her
okay.
CPAP had actually, she was on 10, setting of 10, and now she's on a setting of, I think it's 2, and she's gone
Wow.
down from 6 liters a minute oxygen, and she had to have daytime oxygen at 6 liters a minute. Now she's down to just 2, and you know. Maybe that's a little overkill, and the doctors have been conservative. She used to have it for exercising, but she doesn't take the oxygen for exercising anymore. So in
Wow.
terms of quality of life, this is enormous because she doesn't have to carry around that tank, which
Wow.
she did before, you know.
Wow.
So
So
yeah, it's just amazing. Yeah.
it's a miraculous story. So she she went from a stage 3 near, a very serious, she was seriously ill with the pulmonary
Yes, she was
hypertension to
actually
stage
on
1.
transplant list. Yeah, at one
Wow.
point on that class 3. Yes. Yeah.
Okay, so she was on a lung transplant list. She had diabetes with an A1C over 15, which is blood sugars probably close in the 400s. And
Yeah.
then for those in America, and then the other things was the weight loss and then return of revision and no longer requiring oxygen.
And
So she,
there's one
what
other
else?
thing, and that's the diabetic. That's the pain, the neuropathic pain. She was
Oh,
in agony around the time of diagnosis, when everything was going, really bad. Obviously the diabetes had really taken a toll on her body. It probably influenced affected the pH. But she had this terrible pain. She was prescribed this drug. Well, she tried this. The GP prescribed opioids, actually. Yeah, and also, yeah. So
gabapentin.
tramadol was the opioid, and then also she had another drug for restless leg syndrome, one of those benzodiazepine drugs. Now
Mm.
she's no longer on those, but she was on gabapentin in addition, to the opioids. So and that's what a neurologist prescribed. So
So
those
her
are
peripheral neuropathy went away.
and neuropathy actually when she has no pain in her feet at all.
Amazing.
Yeah.
Uh,
So yeah.
Amazing. So, I mean, I've interviewed Kate before, so what an amazing story. So, is there anything else that you would like to share about your article with our audience?
Well, first of all, I didn't set out. I mean, I'm a scientist by training, although I do. I haven't dealt with data so much. I did more mathematical modeling, and I still do that. So I didn't set out to do this. I certainly want to design, an experiment this way, because we didn't design a clinical trial. We didn't do a right heart catheterization measurement after she got better. We did discuss it with a respirologist, and he said, yeah, he'd be intrigued to see if how much her MPAP, her pulmonary pressure, had decreased, if at all. It did decrease with this remodeling drug. That was the worst one for side effects. Actually, did give the best result in terms of the this MPAP measurement, but of course, with the rapid fluid gain, Kate could hardly walk, so she got a really bad 6-minute walk test. So obviously, what you want to do when you do a medical intervention with drugs, you want to achieve a low pulmonary pressure, high cardiac output, I think it is, and you also want to have a good quality of life, so you can physically walk a long way in a short time. So we didn't do that measurement. We couldn't really justify. He couldn't justify it because it is an invasive treatment. Potentially someone can die if he doesn't get it right. But also it involves nuclear medicine, so there's an exposure rate activity. So he couldn't really justify doing it. But in a clinical trial, then you would do that because you would sign a consent to do that. So we missed that. We're missing that measurement. So I wish we were, had been able to do that from a scientific point of view. And then Dr. Williams, the reviewer of the paper, asked about that, and we couldn't say, hey. But I did ask the respirologist, well, do you think, because of the improvement in the walk test, is it likely that the pulmonary pressure would have improved? And he said, yeah, there is a correlation. So chances are it did improve. But at the end of the day, whether these cardiac measurements improve or they don't improve, at the end of the day, it is the quality of life. And so the oxygen is part of that too. But I think the exciting part of it was that, and this is a tribute to Dr. Esselstyn and the other plant-based doctors, none of the interventions that Kate underwent for the pH or for the eyes, the laser eye surgery, none of them could reverse the legal blindness. None of them was able to achieve the highest value in terms of the walk test. None was able to reverse diabetes. So, and then the neuropathic pain, well, what they gave was a serious drug, gabapentin. So, yeah, so it was able to achieve more than all the interventions put together. And that was not planning on our part, but that's just what happened. And even the respirologist, who's, he lives in a world of drug interventions and transplants. He said, well, yeah, this is what happened. Now, whether the drug side effects would have been as difficult for other people, we don't know. Maybe they would, maybe they wouldn't. Maybe some people would respond better to those pharmacological interventions.
But nobody will have side effects from eating a whole food plant-based diet.
And that's what Dr. Russell said. There's no morbidity. There's, and in fact, everybody should eat it anyway, right?
Right, absolutely.
What was exciting about Dr. Russell is a very sharp cookie, and which I knew he was from the movie, but this is real great. He'd never had a PH patient before. He didn't let on, but when we started, he has since then, since in the last 6 years. But he was able to make the leap. Yeah, also it's definitely going to help, and those greens are going to be very important. Now, when I researched out the literature to write the paper, then I discovered a huge body of research on nitric oxide in the body. So leafy green vegetables promote this in vivo nitric oxide, and this is what's behind all the three drug interventions Kate took, and the fourth one, the calcium channel blocker, which didn't work. So all the research, all the sort of the mechanism behind all these kind of drugs for treating pulmonary hypertension and other vascular diseases is all around this nitric oxide production. And there was a Nobel Prize award in the 1998 to the guys who discovered that this mystery gas was dilating blood vessels, and it turned out to be nitric oxide. So they won the Nobel Prize, and then all the pharmacological research is all based on trying to promote this nitric oxide in the body. Now, it turns out that green leafy vegetables also do the same thing. Now, in fact, if you even do a Wikipedia search on nitric oxide, it will tell you. Now they even have a paragraph about green leafy vegetables. And they cite the very research that we cited in our paper. So now it's becoming more mainstream, that the green leafy vegetables are important. So Dr. Esselstyn, he latched onto this whole idea, probably without knowing about this research, I suspect.
Long before.
Why would he? Because he's a heart, he concentrating on the heart stuff. So he was able to make that leap. And so, but all the research to date on the nitric oxide, all it's done is they've said, well, using not just not the drugs, but the research on using diet, the conventional, medical research people are adding beetroot juice. So they're increasing the nitric oxide through a natural source, and that's great. And that's what Kate did. But what they're not doing is applying the rest of the plant-based diet. And this is what Dr. Esselstyn pointed. So if you look at, there's a little simple mathematical equation which is used in physics and chemistry to do with water or blood flowing, flowing through a pipe or blood through a vessel. And that can be, that's sort of Physiology 101, and it's in standard textbooks. What it says is that the rate of the blood flow is proportional to the radius of the blood vessel, or the size of the blood vessel, and that's what the nitric oxide does. It increases the size of the blood vessels. It makes the flow of the blood go quicker. Then you can get better oxygen into the blood and nutrients, glucose, and so on. So that's going to make you feel better. But also in there is something very important: is viscosity, or thickness, or stickiness of the blood. Now, with the plant-based diet, if by reversing diabetes, you're cutting down the blood sugar, you're cutting down the stickiness, you're cutting down the blood lipids or fats like cholesterol. So again, you're cutting down the stickiness. So by having the plant-based diet, not only are you increasing the radius of the blood vessels, but you're increasing, you're decreasing the viscosity. So you're allowing the blood to flow more smoothly through there. So less blood is less sticky. Now, those diets are using those researchers using the SAD diet, and they're adding on the beetroot juice or whatever. They're missing this other bit, and of course, the plant-based diet, it's both. So, and especially the kind when you add extra greens. So you're increasing your size of your blood vessels, but you're increasing the quality of the blood by making it flow better as well. You're doing two things there, at least two things, and probably a whole bunch of other stuff.
And included the anti-inflammation that's occurring.
Well,
so.
that's the other thing too.
Yeah.
So
Absolutely.
the thing is, diabetes affects. We don't know why the pH reversed. We don't know what causes it. That's why it's called idiopathic. But we do know that, and that there's actually a research study being done at the Cleveland Clinic now with pH patients, and they're looking at the diabetes and trying to cut down the blood sugar, because they figure the diabetes is causing inflammation, which is a problem, and then people are overweight. So again, that's adding inflammation. And again, Dr. Esselstyn talked to us about this. So these are influencing the pH. So we don't know, because Kate, she did reverse 4 different medical conditions there, but they're interrelated, obviously.
Absolutely.
But we don't know how much. But if you eat the plant-based diet, then it's going to improve everything.
Absolutely.
Any condition that you've got. So that's that's important. So, and that was an important discovery here.
Excellent.
So we do know it's only one person, but what would be great is if other doctors can read this now, and some of those researchers in Sweden, the UK, and the US who are doing these experiments with the vegetables and the pH, if they can read this, maybe it'll inspire them to do a full clinical trial, and also get the patients to consume a whole food plant-based diet, not just the standard American diet plus a few extra veggies or beetroot or whatever.
So what an incredible legacy. So she suffered and got better, and then she has the opportunity by you writing her case study to potentially save other lives as well.
Yes, and well, she wrote her own story. Dr. Esselstyn, he lended the inspiration, and he instructed Kate how to follow the diet, and so he's a big part of the whole story, and all the plant-based doctors that are out there as well who follow the same knowledge and so on. And then of course, I, being a scientist, I was able to just tabulate the diet here and craft a story around.
But she didn't have to share, and so we want to thank you for that.
She's been very courageous to share, and
yes.
And not only has she shared her story now through this paper, but we've also put on a health summit in Calgary. We invited doctors to speak here. We sold out the hall. People were really excited.
Wonderful.
Lots of people came. Now we've got Dr. Campbell and Dr. Greger coming this year. So we're doing that, and we're also putting a potluck, which is something that Rip Esselstyn did with people in his community and other people in Detroit and other cities throughout the States certainly are doing the same thing. So we got the potluck as well. And again, we're trying to get the message out. So through these different ways, yes. That's
fantastic. The least we can do as individuals and scientists is share the information that can affect others. That's the whole point. So
that's right.
Absolutely. So we want to say thank you so much for sharing not only your story, but Kate's as well. And please tell her thank you for all of us. And we're looking forward to hearing more about what you're doing in the future. I can't wait to hear about this kidney paper.
Yes, that will be our next project.
All right,
Thank
excellent.
you
All right.
to you and the journal for giving us a medium in which to share this, because standard medical journals, it's tough for a non physician, and it's tough for a case study to get published. Although I see they are starting to appear, but you know.
Yes, absolutely. It's been a wonderful legacy for us to work on and share these amazing stories of transformation. And it's just nothing like it. So we thank you again.
Yeah, thank you.